as a brain doctor, I have to tell you something that shocked even me. For years, I studied stroke. I treated patients who were laughing with their families in the evening, and by morning, they could not move one side of their body. Some could not speak. Some never fully recovered. But what truly surprised me was this. One simple sleeping position, something millions of seniors do every night, can quietly increase stroke risk overnight, and most people have no idea. Today, I want to explain this clearly. No fear, no exaggeration, just science, simple English, and what you can do to protect your brain. Please stay with me until the end. This may change how you sleep tonight. Let us start with something important. A stroke happens when blood flow to part of the brain stops. The brain needs constant oxygen. Even a few minutes without enough blood can cause brain cells to die. There are two main types of stroke. First, ischemic stroke. This is the most common. It happens when a blood clot blocks a blood vessel in the brain. Second, hemorrhagic stroke. This happens when a blood vessel bursts and bleeds into the brain. According to the World Health Organization, stroke is one of the leading causes of death and disability worldwide. In seniors over age 60, the risk rises sharply. Now here is where sleep becomes important. During sleep, your blood pressure changes, your breathing changes, your heart rhythm can change, your oxygen levels can change. If you sleep in a position that restricts blood flow or breathing even slightly, it can create stress on the brain, especially in seniors whose blood vessels are already stiff or narrowed. The sleeping position I am talking about is sleeping flat on your back without proper head elevation, especially if you snore or have sleep apnea. Yes, lying flat on your back. Let me explain why this shocked me. For many years, people thought sleeping on your back was the neutral or safe position. It keeps the spine straight. It looks comfortable. But brain research has revealed something deeper. When you lie flat on your back, gravity pulls the tongue and soft tissues backwards. In many seniors, especially those who snore, this partially blocks the airway. This can reduce oxygen levels during the night. Now you may ask, Doctor, what is the big deal if oxygen drops a little? Here is the big deal. Research from Harvard Medical School and studies published in the journal Stroke have shown that repeated drops in oxygen during sleep, called intermittent hypoxia, increase inflammation, raise blood pressure, and make blood more likely to clot. And blood clots are the main cause of ischemic stroke. One large study from the American Academy of Neurology found that people with untreated obstructive sleep apnea had up to 2 to 3 times higher risk of stroke compared to those without sleep apnea. And guess which position makes sleep apnea worse? Sleeping flat on the back. In fact, researchers at the University of Toronto found that sleep apnea severity can double when patients sleep on their back compared to sleeping on their side. Double. That means twice as many breathing interruptions, twice as many oxygen drops, twice as much stress on the brain overnight. Now imagine this happening for years, night after night, slowly damaging blood vessels, slowly increasing clot risk, until one morning a stroke happens. I have seen this in real patients. Let me tell you about Mr. Daniel. He was 72, strong man, no major health complaints except loud snoring. His wife said he would sometimes stop breathing during sleep, but he refused to get tested. He always slept flat on his back. One morning, he woke up confused and weak on one side. It was an ischemic stroke. Later testing showed severe sleep apnea. This is not rare. According to research published by the National Institutes of Health, up to 60% of stroke patients have underlying sleep apnea. Many never knew they had it. Now, let me explain something even more concerning. When you lie flat on your back without elevating your head slightly, blood pressure inside the skull can rise slightly. A study from the University of Maryland Medical Center showed that elevating the head of the bed by 30 degrees can improve venous drainage, meaning blood flows out of the brain more efficiently. When you lie completely flat, especially in older adults with stiff blood vessels, pressure regulation is not as efficient. For someone with high blood pressure, which affects nearly 70% of adults over 65, this can increase strain on delicate brain vessels overnight, and that increases risk of hemorrhagic stroke. Now, I want to be very clear. Sleeping on your back does not automatically cause stroke. But if you combine these factors, high blood pressure, sleep apnea, obesity, diabetes, smoking history, high cholesterol, then sleeping flat on your back can amplify the danger. It's like adding fuel to a small fire. Another issue is blood pooling. When you lie flat and remain still for long periods, circulation in the neck veins can be affected. Some studies suggest that impaired venous outflow may contribute to small vessel disease in the brain over time. Researchers from Johns Hopkins University have shown that small vessel disease is strongly linked to future stroke risk and cognitive decline. Small vessel disease develops silently. You may feel fine, but inside the brain, tiny vessels are stiffening and narrowing. Now let me talk about something called positional sleep apnea. This is when sleep apnea mainly occurs while lying on the back. Research from Stanford University Sleep Medicine Center found that in some patients, simply switching from back sleeping to side sleeping reduced apnea events by more than 50%, without medication, without surgery, just position change. That is powerful. So what is the safer sleeping position? For most seniors, sleeping on your side, especially the left side with a slightly elevated head, is safer for breathing and circulation. Side sleeping keeps the airway more open. It reduces tongue collapse. It improves oxygen levels. It also may help reduce acid reflux, which itself can disturb sleep and increase stress hormones overnight. A study in the journal Chest showed that lateral sleeping position significantly reduces apnea-hypopnea index compared to supine or back sleeping. In simple terms, fewer breathing interruptions, fewer oxygen drops, less stress on the brain overnight. Now, let me address something important. Some people say, "Doctor, I cannot control my position. I turn at night." That's normal, but there are simple solutions. One method supported by sleep specialists is positional therapy. This can include a body pillow behind your back, a wedge pillow to elevate your head 20 to 30 degrees, or wearing a soft device that prevents rolling fully onto your back. These are simple, low-cost methods, and in some cases, life-saving. Another major risk is untreated atrial fibrillation, irregular heartbeat. Research from the European Society of Cardiology shows that sleep apnea increases risk of atrial fibrillation. Atrial fibrillation allows blood clots to form in the heart, which can travel to the brain and cause stroke. So the chain can look like this: back sleeping, worsened sleep apnea, oxygen drops, blood pressure spikes, heart rhythm disturbance, clot formation, stroke. This chain can happen quietly over years. Now I want to speak directly to seniors. As we age, our airway muscles become weaker, our tissues become more relaxed, our reflexes are slower. This makes airway collapse during back sleeping more likely after age 60. If you snore loudly, if someone says you stop breathing at night, if you wake up with morning headaches, if you feel sleepy during the day, these are warning signs. The American Heart Association has officially recognized sleep apnea as a major stroke risk factor. This is not alternative theory. This is mainstream cardiovascular science. And here's something hopeful. A study published in the New England Journal of Medicine showed that treating sleep apnea with CPAP therapy significantly reduced blood pressure and improved cardiovascular outcomes. But even before CPAP, changing position can reduce severity. Let me also mention something called nocturnal blood pressure surge. In healthy sleep, blood pressure should dip slightly at night, but in people with sleep apnea, blood pressure can spike repeatedly due to oxygen drops. These spikes damage blood vessel lining, endothelial dysfunction develops, and damaged blood vessel lining makes clots more likely. The University of Sydney conducted research showing that abnormal nighttime blood pressure patterns are strongly linked to stroke risk independent of daytime blood pressure. That means your night sleep matters as much as your daytime health. Now, think about this. You spend about 1/3 of your life sleeping. If you're 70 years old, you have spent over 20 years sleeping. Small nightly stress adds up. This is why I am shocked that more people are not talking about sleeping positions in stroke prevention. We talk about diet, we talk about exercise, we talk about medication, but we rarely talk about how you sleep.